We are back here on Carolina Women. Yes, we are having a wonderful and glorious and fun day. Yes, we are here with Revive Rehab. We have Jen, we have Allie, and we've been talking away. I love this subject today. Jen, take it away.
So we are talking today about some myth busting, I believe, when it comes to Kegels. With the pelvic floor, a lot of people...
wait a minute. Jessica's like, Kegels? Wait, I do want to hear this. Come on.
A lot of people only associate pelvic floor care with, leaks or pain, and Kegels, that's the way to fix it. But is it, though?
But is it, though?
No.
No?
So what we're finding is that Kegels are actually making a lot of our patients' symptoms worse, and they're not fixing their leaks.
It's because we're Kegeling incorrectly, or is it
it's not that they're it's not that they're terrible.
too much? Is there such a thing?
It's that the problem is a lot of times the pelvic floor muscles are actually tight and weak, and so if you don't fix some of the tightness first, and you're doing Kegels to an already tight muscle, it actually makes that worse.
Which makes sense to me. So help.
So one of the big things is, I think it's an isolated thing, and it's something that your mom told you, your doctor tells you.
Yes.
You look it up on Dr. Google, and so you find that, and you're either, again, doing it when you shouldn't be, like Allie said, or you're doing it incorrectly. But when you think about what we do day to day, I mean, we don't just sit there and we don't just contract that muscle for any reason. We use our pelvic floor, and it works with us with what we're doing day to day. So why don't we address the issue and look at what's dysfunctioning with the rest of the body?
And so in order to do that,
how do you fix that?
I think we actually get a good,
a good functional full body assessment.
Yes.
So what we find is the pelvic floor is usually compensating for other body parts that are not doing their jobs. Core weakness, glute, hip weakness, poor breathing patterns, poor posture, poor body mechanics, not knowing how to breathe when you exercise. So many things. If we can fix all those other things, the pelvic floor responds so nicely.
So beautifully. So rather than, what you're really saying is, rather than a medical intervention, take a look at the biomechanics and see what's really going on and see what you can do.
Again, like we talked about last time, it's more that holistic focus, and let's really get to the underlying cause instead of putting a Band-Aid or even a false Band-Aid on it.
Exactly. Well, you know what we were talking about before? We were talking about, with Marissa, prevention, right?
Absolutely.
Is it something that at 70 I'm going to come in for maintenance, or how I can't prevent?
Too late, or
well, no, I can't. Well, I can't prevent because I've already had kids, etc. But my question is, I can come in and you can help me through it, but for someone who may not have those issues now, does it make sense on the front side, since we know to be proactive and say, okay, what can I do?
Yeah, I think that's a really great
wonderful
question. So we've actually had a few patients recently call us and that are coming in that are pregnant, and they want to prevent
because they've heard stories
through their pregnancy. And then we also have patients that maybe they're not pregnant or don't want to have a baby, but they're like, well, I think I have this going on. What can I do now so that my symptoms don't worsen when I'm older? So it can go both ways.
And not only that prevention action, but sometimes we're seeing people too that they have this unrelenting and nagging back pain, SI pain, hip pain that they've seen other people for already, and they go through the typical protocol or the typical treatment interventions, and it's
not working,
still not clicking. And because not necessarily everybody looks at the whole body and how it works together, and so what we do is put those missing pieces together, and then something just clicks.
Let me ask you a more broad spectrum question. We've been focusing specifically on the orthopedic part now, and the pelvic floor part and things like that. Is there a way to get a physical therapy kind of overall, I don't even know how to say it, physical or assessment, where I would come in and basically say, here are my symptoms, here's what I'm experiencing, but I'd really like the opportunity to say, is my posture okay? Let me show you my core.
Absolutely. That's honestly what we do for every patient for their first visit.
Oh.
It's a full evaluation, a full body assessment, and sometimes we don't even get to treatment that day because we're so focused on getting the big picture and figuring out exactly what's wrong so we can treat you the right way.
And how can you assess someone? Do they have to basically share what is ailing them and kind of what their challenges are, and then you sort of go from there?
Yep, symptom assessment, but that's a great segue to what we can talk about next time. We're going to tease that.
Well, you know what else? I have a great idea. I think we should volunteer Erin. No, actually, I don't.
She always
Or I don't mind
volunteers
doing
me.
it. We both should.
Yeah.
I would love sometime, even before for B-roll, okay, to do an assessment, and then we'll show it, and you can actually sort of point out some of the things. Doesn't that sound like fun?
Let's do it.
Yeah.
Show and tell.
We love our Carolina women. Stay with us. There's more to come.